because I didn't like what I saw 10 years ago as a surgeon in the effects of surgery on the symptoms of TMD. But there are a lot of other things going on besides surgery, surgery being primary on my mind and primary in my experience. But you end up with things like Botox for the treatment of muscle trismus of the face and the neck or the upper shoulder, or wherever it's used, to paralyze the muscles, which does a good job of paralyzing the muscles, but it does not treat the cause. And therefore, other muscles that haven't been paralyzed will and can be affected. And of course, any of the other symptoms like tinnitus or subjective hearing problems will continue on. And the patient usually does not know that those symptoms have anything to do with inflammation within this joint, within the temporomandibular joint. Botox is on my mind because I see a long litany of people. It seems to be the common thing now. The dentists are getting into it, the neurologists are getting into it, the physical therapists are getting into. Anyone with a syringe and a needle feels that they can and should treat those symptoms of temporomandibular joint with Botox. There are other treatment modalities that are being used that I'm familiar with because I see these patients all the time march into my office with a litany of one or more of these treatments, which can and do include dry needling. That's a treatment that is proposed by primarily physical therapists. And of course, physical therapy, chiropractic, massage therapy, of course, surgery, which I'm very familiar with those modalities, muscle relaxants, myriad of different kinds of drugs, psychiatric and neuroleptic drugs, I've seen used frequently for symptoms. Sometimes when it's under the case of a misdiagnosis, and sometimes when it's under the case of a proper diagnosis, is TMD.